Hey, this is Josh Hewitt. Welcome back to another Straight to the Bar Gym Chats. This is Gym Chat number 256. And tonight we have a friend and colleague of mine, Paul Catanzaro, on, and we are going to talk about injury prevention and management. And Paul has a wealth of experience in training and coaching and working with a variety of different athletes, and some recent experience and some personal experience, unfortunately, with injuries and rehabilitation. So we're going to be getting into that a bit. Before we do, Paul, thanks a lot for joining me on this. It's been a while since we chatted. I'm glad to have you on the show.
Yeah, it's my pleasure. Thanks, Josh.
Before we get into the topic, do you mind giving just a little bit of your own background, how you got into the work that you're doing now, some of your past experience?
To be honest with you, this has been a passion of mine for a very long time, and I was very fortunate to be able to carry that passion into my career. And so now we're approaching, this is now my 18th year as a personal trainer. I'm a certified exercise physiologist with CSEP, Canadian Society of Exercise Physiology, and my career now has spanned over 3 decades, basically, starting in the early 90s and continuing now. I had a facility in Scarborough. We moved about 7 years ago to Richmond Hill, and you know, I just live in my own little world, and I enjoy training people. I enjoy writing for different publications, doing seminars here and there. This is me living out my dream, really.
That's awesome. Yeah, it does feel pretty awesome when you get to do what you're passionate about for your living. Yeah. And you produce some pretty cool resources over the years as well. Some of your online resources that are available too. So you're definitely sharing a lot of your passion with other people out there. I'm getting a cool glimpse of your facility behind you. We were talking about that before. I haven't seen this one yet, so I'm definitely gonna have to come check it out. But it looks awesome.
Yeah, anytime, come by. Absolutely.
Right on. So let's get into the topic at hand. We're talking about injury prevention and injury management, which is a pretty broad topic. If you were going to give a brief definition of injury prevention versus injury management, how would you define either?
Well, the way I look at it, I mean, the very common saying is, an ounce of prevention is worth a pound of cure. You know. Mm-hmm. I've seen many mistakes that the typical trainee makes. A lot of it has to do with planning, a lot of it has to do with form and execution, and a lot of it has to do with certain intangibles in the gym. So we can go through some examples. When we talk about planning, Josh, what you'll notice is that people need to concentrate on proper planning both between programs and within them. Okay, so what I mean by that is, if you stay on a program for too long of a period, a lot of times if you're on too long, you try to force adaptation, it can invite injury. And then again, on the other end of the spectrum, if you're changing your programs too frequently, that can confuse the body, and that can also lead to injury. That's one of the biggest knocks I have against CrossFit right now, because when you have, you know, programs that are basically promoted in a random fashion, you get haphazard results at best, and at worst it can invite injury, and there is a very high injury rate with CrossFit. So proper planning between programs is essential. Now within them, it's very important as well. I have a number of people that come to me on a monthly basis for a new program design. I design the program, they take it, and they implement it at their facility. Okay? Right. And what I've noticed over the years is that the guys that go too hard, too quick, that are a little too gung-ho at the beginning, they're the ones that usually burn out by the end, and they're the ones that have these little nagging injuries that constantly come up. Mm-hmm. So over the years, I've educated them on the fact that you need to start low, gradually increase the resistance, peak, and then taper at the end before commencing a new program. Okay, so the ones that are able to follow that and have the patience and the maturity to go through these proper progressions, they're the ones that do well over an extended period of time, and they subsequently have very low injury rates. But the ones that try to climb too quick are the ones that, fall off the hill by the end. So these proper gradual progressions are important.
Okay, that's a good point. So go ahead.
Yeah, go ahead, Josh.
No, I was just going to sort of, paraphrase what you were saying there as far as planning. You're talking also about not just within the workouts, but during the length of the program and then in between programs. Is there an ideal length of program that you recommend? I know this depends on goals, but if you're to give a sort of a general phase, like obviously a WOD, a workout of the day that, every single time you work out, there's very little progression between workouts or connectivity between workouts. It's very hard for your body to start to learn how to adapt or to have any, for your nervous system to get used to the movements.
Right.
Is there a good length of a program that you should stick with before planning to change things up, where you can get some good adaptation, but you doesn't become stale?
There are some general guidelines, and typically it depends on training age. So, for instance, a beginner, you can present a set of stimuli to a beginner, and they can be on a program for as much as 6 to 8 weeks, to even as long as 12 weeks, depending on their rate of adaptation. Mm-hmm. Most intermediate athletes, anywhere from 1 to 2 years of training, require about 4 to 6 weeks before a new program should be initiated, and an advanced trainee anywhere from 1 to 4 weeks, depending on their level of training. On average, though, usually most people require a new program every month.
Okay. Sounds good. All right. Were you about to touch on something else around that idea, or did that?
Okay. So we can move on. Another area that is quite common is, of course, biomechanics and form. If you walk into a gym, many times you'll see uncontrolled movement patterns, or you'll see reps that are performed either too fast or with too much weight. And these sort of things can invite injury. So, for instance, if you watch someone, typical gym rat who's bench pressing, you go to any gym and you look at the bench press, most guys, they might sit down, they may lay down to perform, a set of 10 repetitions on the bench. But in reality, that bar is hitting them at different points each repetition. It's not one set of 10 reps. In reality, it's more like 10 sets of 1 rep, okay? Mm-hmm. Because to their nervous system, each repetition is a different movement pattern. So it's almost like doing 10 different sets rather than 1 set. And because it's an uncontrolled movement pattern, it can invite injury. Mm-hmm. If we look at Newton's second law of motion, which states that force is equal to mass times acceleration, well, if these uncontrolled reps are done ballistically in a very fast manner, they're basically increasing the forces through the acceleration component of the equation. And then again, if they're using too much weight that they don't have a sufficient base to handle, they're utilizing too much on the mass end. So both ends of the equation can increase the forces on the body and, lead to trauma, lead to injury. Mm-hmm. Okay, so that's another area where, you see injuries occur.
So absolutely, that should be pretty common sense as far as using good technique or good form. But when the emphasis is placed on performance or how many reps or how much weight you can move, often that becomes secondary. People will sacrifice form or tempo to, in exchange for an extra rep or more load. Definitely not worth it. Yeah. Do you have any now again, the rep speed and whatnot depends on the exercise you're doing and your goals, but aside from Olympic lifts or ballistic movements, is there a general guideline as far as tempo? I mean, obviously using proper technique, getting proper instruction on a technique for an exercise, and using control, but around rep speed or tempo, is there any general guidelines around that you recommend for avoiding injury?
To avoid injuries, tempo should be moderate to slow. Now, when I say moderate to slow, we know there's moderate rules for hypertrophy. It depends what your goal is, however, okay? If we're talking about injury prevention, moderate to slow will reduce the likelihood of injury, absolutely, okay? Right. But tempo will vary depending on the goals of the trainee, depending on which body parts are being trained, and so forth. So one common example that I give is if you prescribe 10 reps, which is considered a hypertrophy range for most individuals, and you have a set of twins, and one twin does it at a very fast rate, okay, and they complete their 10 reps in 10 seconds, and the other one does it at a more slow, controlled tempo, and they take 60 seconds to complete. The question I always ask people, okay, well, which one is better? And in fact, it's a trick question because there's not one that's better. It depends on what you're training for. So if the training goal is power, then the first individual that completes it within 10 seconds is going to accomplish his or her objective. Whereas if the training goal is hypertrophy, then the 60-second time under tension would be a little bit better. So a slower tempo might be more appropriate. But it depends on your goals. For injury prevention, slower tends to reduce the amount of forces on the body and will reduce the chance of injury. But fast can be done in an explosive manner, in a controlled manner, and should also be safe with a seasoned athlete. Problem is, when you have an unseasoned athlete that's doing these in an uncontrolled ballistic manner, you're looking for trouble.
Makes sense. Yeah, and that should be, again, although we're going to use, I'm using the term common sense, which isn't so common. But yeah, the slower and more controlled and the better your technique, the less the risk of injury, clearly. Yeah, and the more experienced you are and the more practice you have, probably the more likely you're able to handle quicker reps, more ballistic movements properly. Right. So getting into this, I mean, you talked about people that progress really quickly tend to have, or if they're really gung ho initially starting a program and try to ramp up their weights or progress very quickly, may have a little higher risk of injury. So you generally prescribe progressions that will help initially with a program to prevent this. What about during a workout itself? Is there anything that you recommend as far as part of a warm-up? And I'm sure we get a whole gym chat on just warm-ups, but in general, movement prep, warm-ups during each individual workout to help prevent injury.
Okay, so it's a bit of a loaded question, but when you're looking at the workout itself, you should have a plan in mind. However, the day should actually dictate your loading. Okay, and what I mean by that is intensity you should always plan your intensity, but depending on your performance on that day, it will influence the amount of volume you do. And when I say volume, it's with regards to sets. For instance, if you plan to come in to train one day and you're performing back squats, and your goal is to do 5 sets of 5 with 315 on the back squat, okay? You might do your first set, 5, do your second set, you might drop to 4. If on the third set your performance drops considerably, you should terminate for the day. So if you're only able to muster 1 or 2 on the third set, you should terminate for the day. Trying to force out additional sets just because on your log sheet, on your prescription, you're supposed to do 5 sets of 5 that day. Well, if the day dictates that your performance falls off after the second set, terminate there, because if you try to press on, again, you're going to be inviting injury. And that's one thing that I see with younger lifters. As you mature, you're able to listen to your body more, and you understand when it's time to back off and how to back off appropriately and when it's time to push forward. Now, let's say, for instance, Josh, you were coming in that day, your plan was to perform 5 sets of 5 with 315 pounds. You go to do your first set, and you barely get 275 up for 5. Well, you're not ready to train that day. You need an additional day of recovery. So that's how that's how you can listen to your body, how your body and your performance can dictate whether you should train that day and how you should train that day. Okay, so you need to be somewhat malleable. You might have the parameters all set out, your program all laid out, but you need to listen to the body and be malleable. If you don't get that performance on the first set, that means you need an extra day of recovery. Trying to push off not only invites injury, but will likely sacrifice performance thereon. So you need to listen in that manner. Now, warm-ups are a completely different animal altogether.
Yeah, that's what I'm, yeah, okay.
Yeah. Warm-ups.
So, yeah. Yeah, warm-ups and like sort of movement prep and like stuff you would do before you get into the reps and sets in your program.
Yeah, I mean, these days there's so much about mobility work, foam rolling, and all these gimmicks, and they all have their place, yes. But the problem is, I love the way Dan John puts this. He says, think of your body as a sandbag, okay? And as you're starting your workout, poke a hole in that sandbag, flip it over, okay? That sand will start to flow out. That reflects your energy and your resources, so to speak. No matter what you do, whether you're warming up on the bike or on the treadmill, whether you're performing static and dynamic stretching, mobility drills, and all this other, I want to say nonsense, right?
Okay, pick your words carefully. No,
you're basically emptying that sandbag. By the time it comes to any real lifting, there's not much left, okay? Much better would be to get to your specific warm-ups. If you're going to do the back squat, much better to get under the bar, start with just the empty bar, do 5 reps or so, put on a 45 on each side, do another 5 reps, put on a quarter, now you might drop to 4 reps, put on another 45, drop to 3 reps, and work your way up to your working weight, which is 315 pounds, and doing it in small gradual progressions in that manner. That's a much better way to plan for, to warm up for the specific exercise that you plan to perform, and make any adjustments as necessary, rather than just going through some traditional warm-up because this guru says you should or that guru says you should. Not everything works for everyone. If there's one message I want the viewers to get from this show, it's that there are many ways to skin a cat. You have to find what works well for you, what resonates well for Josh, what resonates well for John Paul, what resonates well for you, okay? Because not everything is going to work for everyone, right? And even if it works for you during a certain period, it may not work for you during another period. Foam rolling is a classic example,
I like that. We got into a little exchange on that on LinkedIn, I think it was. You shared some articles.
I think there are pros and cons to it, but I don't think it's the end-all be-all. What I found personally is initially you get someone rolling on a foam roll, and it's like you're scraping out their insides, It's extremely painful. But after a while, initially they might not be able to stack both legs if they're rolling their vastus on one side and their hamstrings on the other side of the IT band, right? Initially, it's just one leg support on the ground because they need to deload somewhat. Then they go to 2 legs stacked, right? But once that becomes easy and you no longer feel that tension as much anymore, I find that the value of foam rolling really ends.
Yeah.
So you can use it as a separate entity if you wish, but to go through that during your pre-workout ritual, for some people, actually can be counterproductive. I've known a couple guys that have actually experienced injuries and have had to cut their workouts short because of that. So it's it's not the cure-all that people make it out to be.
Yeah, and like you said, maybe it has a role in some cases for some muscles initially, but to do it just by habit, I mean, some people just foam roll their entire bodies all the time as if they can't lift anything until they've targeted every muscle with a high density foam roller.
Right.
It might be a little, and I've heard debates of whether it's similar to passive stretching or not, and like some people say no, it doesn't dampen the nervous system activation. Some say yes, it's just like stretching. I know there's studies on both sides, but what is your, just on that topic briefly, do you have an opinion on static stretching pre-training? Because everyone's, there's back and forth on that.
So I mean, I've gone through this quite a bit in the past. I've had an article series, Stretch for Strength. I've had a DVD series, Stretch for Strength. I've done a number of seminars on this topic, and we right now have a video presentation at stretchforstrength.com.
Yeah.
And the studies clearly show that static stretching will temporarily weaken the muscle. I mean, there's no secret to that, okay? Now, that doesn't mean that it's necessarily bad. It can have its advantages in certain cases. For instance, if you have a hypertonic muscle, the traps are a classic example. You can use static stretching initially to soften or weaken those fibers to help promote better scapular setting in some cases. For instance, during bent over rows. So if you start to hike up the shoulders when you're doing bent over rows, you'll usually notice wrist flexion at the other end, right? And how do you correct that? By temporarily weakening these fibers, setting the scapula in its proper position, usually can improve the wrist position. So you can use these sort of things as tools in your toolbox, but to just go through, you know, a whole series of static stretches beforehand because tradition dictates that, for a lot of people, it's shooting themselves in the foot. It's no different than doing too many reps during a warm-up. So you can do a specific warm-up. You can do that squat. But if you're performing 20 rep squats to warm up for your 315, right, what are you doing? You're increasing lactic acid production. That increase in hydrogen ions will temporarily weaken the fast twitch fibers, and so you're, again, shooting yourself in the foot. And too many reps during warm-ups have been linked to increased tears. Yeah. So, you know, you need to be careful on how you approach these things as well. Right? Yeah, no, that's a good point too, because I see a lot of people, well, it's their warm-up, they think because it's a lightweight, they think they have to take it almost to fatigue as well, or do a bunch of reps. So I think that's a really good point, which you know, I always, if I'm training in something in the like the 5 rep range, my warm-ups don't exceed 5 reps. I don't know what your opinion is on that, but I never take it anywhere. Anywhere close to fatigue and warm-ups, I always just try to go through the form, try and get the muscles activated. I'm not trying to necessarily get warm or get my heart rate up doing those reps. That's right. These are practice sets. They're rehearsal sets. And basically, you need to tell the body 2 things. You need to tell the body what range of motion you're working in and what load you'll be using. That's why you want to progressively increase the load until you get to your working weight, right? And that's it. And a lot of it is related to your nervous system, I guess, in that case. That's right. Not just muscles and joints. Yep. Awesome. Okay, so we're looking at, was there anything else that you wanted to touch on for injury prevention? There's a number of things. Proper placement of equipment. Not too long ago, there was an incident in Toronto, in the Greater Toronto area, at a high-end club downtown, actually, where a brand new trainer took in a sedentary individual. This was her first workout, middle-aged female, a little bit out of shape, hasn't been active since high school, and she decided to do something, basically jumps on an upside-down Bosu ball. So what she instructed this client was to jump on this upside-down Bosu ball and stick the landing, right? Yeah, classic. Well, obviously, what ended up happening, this lady lost her balance, she fell backward, and because of where she was positioned, she hit her head onto a lap machine, on the corner of a lap machine, and she was concussed. So where you do, first of all, that type of practice, in my opinion, is it's idiotic. You know, if anything, it's criminal. Okay. Yeah. But that aside, where she was positioned, obviously wasn't safe. You know, it's the same thing that, you know, that CrossFit incident that happened not too long ago, where the bar jumped back and hit him in the back, and you know, so placement of equipment, being in safe proximity. A lot of people, when they finish a set of dumbbell presses, for instance, they go to drop them on the ground. If there's other dumbbells laying around, they clip their fingers. I've seen some horrific accidents in that, right? Yeah, that's awful. Yeah. So that kind of stuff. Getting back to the uncontrolled movements doesn't only occur in beginners. I remember one of the more horrific accidents that I saw in the gym was an advanced lifter. And this guy was on a lat pull-down machine. And he made sure that everyone knew he was on the machine. And he made sure everyone saw that he was lifting the entire stack, right? Yeah. But he wasn't really lifting it with his back. What he was doing was basically a low back exercise, because he was swinging like a maniac. He was swinging like a maniac. He was yelling every rep. It doesn't really matter how much you lift. It matters how much people think you're lifting, right, or see that you're lifting. I guess. Right? You know, it's just, it's just all, it's for show, really. You don't have to get anything out of it. Yeah, okay. Absolutely. And what ended up happening was the cable snapped. And this guy got it in 2 ways. Oh, no. He got it hitting the back of his head on the concrete ground as he went back, and he got it with the bar smacking him in the head.
Oh, no.
But it pretty much silenced him at that point, and I never saw him back at the gym after that.
No, of course
So
not.
you got to be a little bit smart when you train.
Yeah. Oh my God. Yeah, I'm sure we could tell horror stories back and forth of injuries.
Yeah.
Getting into that, you actually, we just briefly touched on it, but do you mind sharing? You just going through some pretty rough rehab yourself.
Yeah, I had a nice injury earlier this year, April 4th to be exact. I was tapering that day. I was working arms, and third set, third rep on the one-arm dumbbell preacher curl. As I went to lift the weight, it sounded like branches breaking in my arm. And I knew something was wrong.
Yeah, that's not that's supposed to happen.
My hope was that it wasn't as serious as I initially thought. But as soon as that happened, I finished the workout, took a quick shower. My girls were competing that night in dance, so I went to see them. The next day, I decided, let me go to the nearby hospital to see if we can get some diagnostics run on this. Now, I want to say that, we need the medical system for certain things, but my faith in the medical system these days is a little bit up in the air, okay? And I think a lot of people need to be their own doctors. In my experience, by sharing this experience, will hopefully pound that home. The next day when I went to a local hospital, waited there 2 hours, saw the emergency room doctor at that point, a young guy. He looked me in the eyes and said, "What's the problem?" And cocky guy, actually. And I turned to him and I said, I experienced a weightlifting injury yesterday, and I suspect it's my bicep tendon, distal bicep tendon. And he looks at me, he says, make a muscle, right? So I made a muscle for him, right? And he looks at it, he feels it, says it feels fine to me. He goes, resist against me. So I resisted against him as he's resisting my elbow flexion. Looks fine to me. He didn't even do a hook test. Normally they would do something called a hook test. He said, I can tell you I'm 95% sure your bicep is fine. And I said to him, is it possible, can we run some diagnostics? Can we do an ultrasound on this? He goes, no. He goes, we can do an x-ray if you wish. I said, well, what's an x-ray going to tell us? It's not related to the bone, right? Yeah. And he said, listen, go home, take some ibuprofen, get some rest, and you'll be fine. He goes, you don't need to worry, your bicep is fine, right? Oh, so I'm walking out of the place, and I'm thinking to myself, wow, this is crazy, I get home, I'm preparing lunch, my wife's there, she said, how did it go? And I said, I'm positive something's wrong. I suspect it's my bicep. It did recede slightly. And I said, it's just not sitting well with me. So I texted an MD friend of mine. I said, listen, this is the situation. Is it possible we can run an ultrasound, right? He said, John Paul, come to my office first thing on Monday, and I'll give you a requisition, and we'll get it done, right? Yeah. So I did on the Monday morning. This occurred Friday night. Saturday I was at the hospital. Monday morning I was at my friend's office. He wrote me the requisition. He said, go to the ultrasound clinic upstairs, and we'll expedite this diagnostic. That was Monday. Wednesday, the ultrasound was run. Thursday, I got a phone call from the doctor. He said, your fears, unfortunately, have come true. It is the distal bicep. It is a complete tear, and it needs to be repaired as soon as possible. Come first thing tomorrow, pick up the ultrasound results, and go straight to the hospital and get it scheduled. So I did. The following morning, I picked up the ultrasound results. I went to a hospital where I have a few contacts, and again, I had to go through the whole process, going through emergency room and all that nonsense, and even he was questioning it. They actually had an orthopedic surgeon come down, and he was still questioning it too, and they said, but, since you do have the results, we're going to run an MRI. This was on Friday. They ran the MRI on Monday. Wednesday, I received a call. The MRI was positive. It is a complete tear. and I need to meet with the surgeon, the head of orthopedics at this particular hospital. She's an upper extremity specialist that specializes in this. Yeah. And I met with her on the Monday, and I was basically, I had the surgery the Wednesday. So within 3 weeks, I had the ultrasound, I had the MRI, and I had the surgery all performed. Yeah. And that's the key time for these sort of things. She told me that it was 90% torn, that it was still hanging by 10%. And I think that's what baffled these guys initially. Yeah. And so she was able to repair it using a method known as the endo button method, which I don't know if you're familiar with. No, the way that works is they basically recess the tendon from the radial tuberosity. They drill through the radius with a thin drill, and then they drill through with a slightly thicker drill. Then they attach these very strong sutures onto this little button, and the button is fed through the bone and clips onto the other end, and then they pull the tendon right in. They inset it right into the actual bone and tie it on the other end. There's a little screw that they tie it on, and it's a very strong procedure. It's very interesting the way it works. And what I've been told is that this is becoming quite common. I mean, it's very common for individuals in their 40s to 70s, but now even as young as 30s, you're starting to get this quite a bit. And of course, it's common with weightlifters, it's common during the preacher curl, it's common during deadlifts, it's common during tire flips. Yeah. We're seeing it a lot now in CrossFit with kipping pull-ups. Coaches, gymnastic coaches, very common when they're catching their athletes, people just lifting when they're moving furniture. It's, you know, so it's becoming more common. My question is, why is it becoming more common? Why is there this degeneration or deterioration in the tendon, and, you know, without any prior warning? And that's what I'm trying to investigate right now myself. But the rehab is coming along quite nice. It's a lengthy rehab. You got to be very careful with it, but there's, you know, a very good outcome if you're patient.
Yeah, good. Yeah, I think just the recovery from the surgery itself takes a long time. And like you mentioned, tire flipping, that's how I tore my distal bicep too, but I think it was still more than 50% of the tendon was there. So they didn't, I didn't have surgery. Although, now, I don't know.
Sorry, Josh, a procedure that might interest you is something known as a platelet rich plasma therapy. The PRP is, as it's known, or sometimes termed, the blood patch. And there's an excellent physician in our area that does this. His name is Dr. Anthony Gallia. And I was introduced to PRP ages ago. He did it on my common flexor tendon of actually both arms, when I was experiencing a little bit of tendinitis in both forearm flexors. And I'm telling you, within 3 sessions, that completely rejuvenated my chin-up and pull-up strength after going through a number of different therapy sessions for a couple of years, actually, with no true relief. So I was sold on it. But it was a colleague of mine who had a supraspinatus tear and was scheduled for surgery. And he went in, and again, Dr. Gallia performed the procedure on him. It's very important that you have the right practitioner doing it. More and more practitioners are doing it, but if they do not inject the right spot, you can cause more trouble than good. Okay. For instance, if they hit, for people that don't know what PRP is, it's basically, it's such a crude practice, and yet it's so effective. Okay, what it is they take blood. So if they're injecting your left forearm, my left forearm tendon, they'll take blood on the right side, they'll spin it so that now you have all these rich platelets that are rich with all these healing factors, and then they'll basically bathe the area of the injury with your own blood. Again, rich in all these healing factors, okay? So any modality that you use, whether you're going for active release technique, whether you're going for muscle activation, ultrasound, acupuncture, massage, you name it, what is it trying to do? It's trying to bring blood to the area. Well, this is physically, manually bringing your own blood to that area, okay? And how effective is it? Well, for this colleague of mine, he Galia said, let's give this a shot first before you go in for surgery. And so it was done under ultrasound. They went right into the foramen, right into the actual tear. In 3 sessions, it was completely fused and healed. He was ecstatic. So it can be quite effective for those type of injuries, something to look into. You know, for ligamentous tears or instability, there is a procedure known as Prolotherapy, which may also
increases inflammation, basically.
Yeah, pretty much. So they would inject an irritant into the area, usually a dextrose solution, for instance, and that, you know, promotes the whole inflammation cascade, right, to occur. Which brings up another point, Josh. 2 years ago, I wrote an article called Novel Methods of Injury Rehabilitation, okay? And during that article, I coined the acronym METH, which stands for Movement, Elevation, Traction, and Heat. I can't tell you how many phone calls I've received, how many interviews I've done from this acronym, how popular it is today. Earlier this year, a man by the name of Gary Rhino, who wrote a book called Iced, he sent me a copy. This, I highly recommend everyone to pick up this book, because it's going to be a huge eye-opener, because traditionally the whole RICE acronym, rest, ice, compression, elevation, you know, it's the same thing as performing lots of reps during warm-up, doing cardio during warm-up, doing static stretching. We have tradition. Well, RICE seems to be a tradition that continues to linger. And the guy who coined that in the late 70s, a guy by the name of Gabe Merkin, an assistant professor who basically was involved in a book called Sports Medicine. He himself has done a 180 and has said, you know, I think I may have done people a disservice by recommending this RICE acronym, because what we have found is that it may not be the most effective way to treat an injury. In fact, the opposite might be better, okay? And so we know that, you know, inactivity may not be the best approach. Being active and actually promoting heat, promoting blood, promoting circulation to the area is how the body heals. And by trying to ice it, for instance, you hinder inflammation. Well, the healing process has 3 parts to it. The first is inflammation, the second is repair, and the third is remodeling. You can't get to the repair or remodeling without the inflammation. And what does icing do? It basically slows down that inflammatory. It hinders it. And if you take something like a non-steroidal anti-inflammatory drug, it completely stops it in its tracks. So all you're doing is you're delaying the process, right? So I may be, me and perhaps Gary Rhino are the only guys that maybe, you know, embrace inflammation. Inflammation is not such a bad thing that it's made out to be. It can be bad in a chronic sense.
Exactly.
Yes, absolutely. Chronic inflammation is not something that you're looking for, but in the acute stages, it's absolutely necessary. Right?
No, that's a good point. No, I've read a little bit about prolotherapy, and I definitely agree with the idea of movement as part of an active recovery, as opposed to just resting or inactivity when you're trying to heal something. Definitely, you want to be moving. What was that that acronym that you used?
METH.
METH.
I mean, all you have to do is just Google METH, and you're going to get a whole slew. You'll see how popular this is these days, right? People are starting to embrace it more.
Right on. Cool. No, I think that's definitely a whole other area for people to look into as well. We could probably do a whole chat just on METH. So we've sort of moved from injury prevention. We're talking about management and rehabilitation or treatment of injuries a little bit. We talked about prolotherapy. You talked a little about PRP. Let's get into something sort of as something that people can do on their own with regards to if they do sustain an injury, and of course there are a bunch of different types of injuries. This is a good start. Talking about movement, active recovery, maybe heat versus ice. Don't be afraid of inflammation. In general, what do you recommend? And again, this is going to be pretty general. Maybe I don't know if you want to pick a type of injury. What would you recommend as far as part of the rehab or management of an injury?
Again, it's a loaded question, but a lot of it has to do with what you take in and what you use, and what you don't take in and what you don't use. So for instance, it stands to reason that if you have a connective tissue injury, that consuming connective tissue as part of your food source may be beneficial, may provide the right raw materials to rehabilitate and heal that injury. Okay, so when we're talking about connective tissue, what are we talking about? We're talking about eating the ends of chicken bones, for instance, of ribs, having bone broths and stews, those sorts of things. Gelatin is excellent for rehabilitating connective tissue because it's very high in collagen, or provides the raw materials that help to build collagen. So in particular, gelatin is very high in proline, lysine, and glycine, which are necessary for collagen synthesis, right? Mm-hmm. So, you know, relying too much on lean meats might not be the ideal choice. It stands to reason that if you have a muscle tear, well, then eating muscle meat might be a better approach in that regard, right? So what you bring in is important, but also what you don't bring in is important. For instance, if I'm suggesting that in the acute stages, inflammation is important, bringing in certain anti-inflammatory agents may not be your friend during those initial stages. And what's a classic natural anti-inflammatory agent that a lot of people consume?
Well, a lot of people take fish oil. I don't know if it's directly anti-inflammatory.
Absolutely. You hit the nail right on the head, okay? Mm-hmm. So I can tell you that anyone who consumes a decent amount of fish oil on a daily basis, if they get a cut, it takes a while to clot, okay? Mm-hmm. So if you're shaving and you get a cut and you're taking a good amount of fish oil, it's going to take a while for that cut to clot, okay? Now, think about if you take a deeper cut, say a surgical incision, right? Why do they tell you, why do they advise you to stay off fish oil? It's very important that you stay off fish oil for at least a week or two before you go in for any surgery. Why? Because it thins out the blood and it's going to basically impair your ability to clot. It's going to impair your ability to heal. And what I've found is that a lot of people consume this stuff right afterwards as an anti-inflammatory measure, which may in fact hinder their ability to heal. So a small maintenance dose may be indicated, yes, 1 to 3 grams perhaps, but it should be matched with GLA as well. So you're not just bringing in the active constituents, EPA, DHA, you should match that with GLA for a better healing effect, so to speak, right? So that you can bring in some of the prostaglandin E2s as well, series 2 molecules. So that's very important. We know hydration is extremely important, but here's the thing. Think of your body, think of collagen, for instance, as the raw materials are like a house. They're like the bricks of a house, okay? So you have your amino acids, you have vitamin C that facilitates the process. Well, the mortar between those bricks is comprised of water and this compound known as hyaluronic acid. I'm a big fan of this stuff, hyaluronic acid. Yeah. If you Google it, HA is the short form that they use. A guy by the name of Bill Sardi has written quite a bit about it. Okay, the hyaluronic acid is basically the glue that holds that mortar together. And we know that as we age, that compound starts to diminish, right? That's why, you know, when you're young and you have a high amount of hyaluronic acid, you have a high amount of enzymes. Enzyme production starts to taper right after the age of 27 to 28. You have a high amount of your hormone levels, obviously, are peaking at a younger age during your late teens, early 20s. And even hydrochloric acid, you know, your basic enzymes are extremely important as we age. And we're not talking just digestive enzymes for your meals, because obviously it's not just what you eat. It's what you eat, digest, absorb, and assimilate. Okay? So digestive enzymes are crucial during that period. But also between meals. We know that proteolytic enzymes taken between meals are one of your most potent weapons that you can use. Okay? In fact, proteolytic enzymes are the #1 pill popped in Europe beyond any medication or supplement. They know the importance of this stuff, okay? And if you want an excellent review on it, there was this, I believe it was called Systemic Review by a guy named Dr. William Wong. If you can find that online, it's excellent. And it'll go through how the East Germans use this stuff by the boatload, but between meals to digest injured tissue and scar tissue and basically initiate the healing process. That's why when you're
William
young,
Wong, W-O-N-G?
Yeah, I believe that's what it is. William Wong,
okay.
Yeah. The expert.
All right, perfect.
Now, that's why when you're young, Josh, and you experience an injury, you bounce back within days. As you get older, you don't have those resources available to you, okay? So that's where supplementation in that regard can help. There's certain modalities. For instance, here's one. I don't know if you can see this. This is a, you see this?
Yeah.
It's a laser pointer, okay? You can get a simple keychain laser pointer at, you know, Staples or any store for under $10. This may be the most potent form of healing beyond any medication out there, and there is a bunch of evidence to show its efficacy, how powerful this can be. And this stuff, I mean, it's just by simply pointing it over the injury. Think of it as there are certain cells within the body, they're called chromophores, that accept the light. It's very similar to how photosynthesis works in a plant. And it basically initiates the whole healing process. And this was brought to my attention years ago from a colleague of mine, Yusuf Omar. He was recommending that I use a little bit of Traumeal over, which, by the way, I'm not sure if the viewers realize, but Traumeal has been pulled off the North American market just last month. So now, you know, you have to get your arnica cream from different, from other sources. Sorol, for instance, has one that they distribute from Pharmax. I believe it's called Pharmax Relief. That's their form of arnica cream. But they're still in the store, so you know, if you love the stuff, I would try to stock up as much as possible now because you're no longer going to get it soon. Okay, but what he was recommending was put a little bit of arnica cream, Traumeal, and then use the laser pointer to help the absorption into. You get better absorption with the laser pointer over it after. So, which is quite interesting, right?
And any basic, you know, school like Staples laser pointer, we should do it.
That's it. That's all it takes. It's a low-level laser therapy, okay? And it's enough that it will. It's in the proper wavelength for human tissue. So you don't need anything expensive or extensive. Just a simple laser like that over the tissue will initiate the and encourage healing. So that's a nice little trick that people can use. But one caveat: don't point it in your eyes. Obviously.
Your eyes, yeah. Don't heal your eyes with it.
And you're pretty much safe.
Yeah.
Okay?
Perfect.
Other creams, by the way, you know, another one that the naturopaths love, and actually some people, it resonates quite well with them, is castor oil.
Yeah, I've used that myself, actually, strangely enough. I was Googling. That's one of my staples, castor oil and then coconut oil, but not for injuries. But those two oils I always stock up.
Huge fan of coconut oil.
Yeah.
Huge fan of anything coconut, by the way.
Yeah.
But castor oil, which is also known as the palm of Christ, as they interpret, will help with lymphatic drainage in the area. And a lot of people put that stuff on at night, wake up the next day with little pain. So that's something you can try. But the caveat there is the stuff is very messy. So you want to make sure that you put on, you know, some scrap clothing because it'll make a mess out of your clothes.
Yeah, it takes a while to soak in.
Yeah.
So apparently oil of Olay and all of those secret skin recipes have castor oil, a lot of them, at least oil of Olay, I heard, had castor oil in it as one of the active ingredients. Yeah, it's great for, you know, externally for skin use, topically for stomach ailments, I've heard, and even sometimes you can use it a very small amount internally for certain issues, but it's great stuff.
The way, you know, the saying we have for any skin product is if you're not willing to eat it, don't put it on your skin. Because many times you get better absorption actually through the skin than you do through the GI tract. A lot of people don't realize that. Okay, the guy's name is Dr. Martin Fox, who did the studies on this, and they show that mineral absorption is much greater, above 68%, for instance, if you lay in a bath for 20 minutes, and if you were to ingest that amount orally, which is around 20% absorption. That's why an Epsom salt bath is excellent for your skin. You make a whole soup out of it. So basically, you go quite liberal with the Epsom salts, with sea salts as well, and use a little bit of baking soda that will act as an exfoliant to the skin, and a splash of apple cider vinegar, just a splash, okay? And that will help to, basically will help to promote the proper acidity of the skin. And then you just make this whole soup out of it, you lay in it, and that's one of the most therapeutic things you can do, not only for skin, but for overall health and for restoration.
For getting absorbing the magnesium through your skin, basically, from the salts?
That's right. Yep, from the magnesium sulfate, absolutely. Yep.
Because I've wondered, I've done it the odd time when when I've been feeling achy or a lot of DOMs, and it has helped, but I've always been a little skeptical about how much of this really does get into your system if you're not taking it orally. But no, that's interesting.
So Dr. Martin Fox is the guy. I believe the publication, it's a small booklet called Healthy Water. It's something that you might want to check into. Another thing that helps too is contrast therapy. I can tell you. Cold heat, cold. This is where you might benefit from cold. So we don't want to discount everything completely, dismiss it completely. But contrast therapy can be much like putting yourself in a vacuum and just speeding up the recovery process. And I was the first time I was subjected to true contrast therapy was at a mentor of mine, Dr. Mel Sith, at his ranch in Colorado, and it was Dave Tate and I, and so we were in his backyard. It was late at night, and Sith had this jacuzzi that was like I believe it was 10 feet deep, if I recall, 8 or 10 feet deep, taller than us. Okay, and he had handlebars around it. It was set at 110 degrees Fahrenheit. Okay. So he said to us, he goes, "Okay, get in, right?" Me and Dave, Dave's huge, and he said, "Get in, right?" So you go to put a toe in, it's like, holy cow, man, this is burning. It's hot, right? Yeah. But we went in. You hold on to the handlebars because the whole key is decompression, right? And then after a minute or so in there, he said, "Jump in the pool." He had a pool beside it in the low 60s. He said, "Do a couple laps in the pool," and we did back and forth. I'm telling you, I have never slept like that in my life. What a deep sleep I had. And in the winter, what Sith used to do with his athletes is he'd get them to roll in the snow as the cold, and then get them to jump in the jacuzzi back and forth in that manner. So that can be beneficial. Now, if you're going to do it in the shower, it's good to actually soak the entire body from the head down. And then we are fortunate in our ensuite. We have a separate tub and shower, and so what you can do is you can do the heat in the shower and then go directly. You could do the cold in the shower, and go directly into the hot tub and go back and forth in that manner. So that's a nice way to do it.
Yeah, I have that actually. Our washroom is set up like that too. We have a stand-up shower and a tub right beside it. I thought it was kind of stupid to have that set up, but that'd be a good use to it.
Or if you have a removable shower head, Josh, you can localize it in one area, hot cold in one area, right?
Yeah. That's true too. Yeah.
That's another.
I went to Russia, to Belarus. Actually, my wife's family's in Belarus, and in the banya. And I'm not sure if you're familiar. I think it's also there's Swedish saunas and everything too. But in the Russian banya, the Russian sauna is a very hot sauna where they have the eucalyptus leaves and they beat you with these vine leaves basically to increase circulation, and then you jump in an ice tub basically and go back and forth, same thing. And that was my first experience there. Her father took me away, a camping trip. They didn't speak a word of English. I didn't speak much Russian, and separated me from anyone I knew and took me to the woods and forced me back and forth into the cold pool, like ice water basically, like you're talking about, and then back into the sauna. beating me to within inches of consciousness
Right.
in that heat, and I almost literally did pass out. And I guess they were testing me. I passed apparently later, but
Right.
I was
Good.
just like sucking it up, just like they're like, let's see what these Canadians are made of, right? They think they got
Right.
cold there, we'll show them. But the only thing there, I think that counteracted the effect. I did sleep really well, but they made me take a shot of vodka each time I went in, so I don't think that was part of the healing process.
Right.
But yeah, it's definitely I've anytime we have Russian banyas here in Toronto nearby too, and I've gone a few times. I love it. That sort of
I
contrast
talked
therapy.
about a number of these restoration techniques in my book, Mass Explosion, that came out last year. So if anyone's interested, we go through a whole slew of them. I'll give you another tip if you want. Directly post-workout, earthing is one of the best ways to quench free radicals. So instead of popping down all these antioxidants, which can actually have the opposite effect, they can act as a pro-oxidant if you take too many. The best thing to do is to basically take off your shoes and socks and just go and stand on the grass. At any given moment, there are at least 1,000 storms going on around the earth. We have one happening right now in our backyard. But and so all those electrons get absorbed into the earth, and that's one of the best ways to quench them. Just simply taking off your shoes, or even if you're doing an upper body workout, just simply putting your hands on the ground, on the grass, on the soil, is enough to quench those free radicals. I remember when my little guy, my son, he was just a toddler, and he was crawling around, and he stumbled, and he broke his forearm. And so we took him to the hospital, and they did an x-ray, and the doctor was looking at it. She looked at it, and she said, I'm not quite sure if that's it looks like a break, but let's take another x-ray. And I'm like, are you serious? So they subjected the poor kid to 2, and I was holding them the entire time, trying to absorb some of it myself. And the second we got home, the first thing, they casted him, and I said to my wife, I said, bring him over here for a second and just put his hands to try to quench some of that. Which reminds me of another point. If you're going in for surgery, one of the best things you can do, although they'll warn you not to beforehand, is doing a high load of vitamin C beforehand. Not the day of, but the day before, and if you can get it through an IV, it's even better. And then directly after, so the day after, if you can get another IV drip, it works extremely well. So these vitamin drips will help protect you, particularly the vitamin C, from a lot of the impurities that are basically pumped into you from the drugs. And then using a hydrogen peroxide drip. There is a naturopath, he's a naturopathic and medical doctor. He basically combines Eastern and Western medicine. His name is Dr. Fred Huey. He has 3 locations in the area. He's got one uptown, one downtown, and one in Barrie, actually near you. And he does these vitamin drips, okay? And what he explained to me is that the hyperbaric chamber is very popular. A lot of athletes will do the hyperbaric chamber to speed up healing. Well, the hydrogen peroxide drips will basically infuse, it will produce up to 4 times atmospheric pressure, where the hyperbaric chamber is only 2 times. So you can get a much better effect through the hydrogen peroxide drips. You can basically have a much better effect at oxygenating the body. And I can tell you from firsthand experience, it works extremely well. So alternating between vitamin drips and hydrogen peroxide drips post-surgery is a very effective way to heal. You can speed up your healing considerably.
Okay, that's something I hadn't heard of. Yeah, that's something obviously people would want to do some more research into before finding out. But what was the doctor's name?
Well, where they could look, the doctor is Dr. Fred Huey. But where they could look to find a practitioner in their area is acam.org.
Okay.
All right. Yeah, American Academy of Advanced Medicine, something of that nature. acam.org.
Okay. And I'll do a little search on a lot of the links and resources we've been talking about, and make sure I'll include them down below in the description.
Great.
Okay, that's great. I think we've covered a lot, and this is going to give people a lot to also look further into, as far as prevention as well as management and rehabilitation. Was there anything else? I think that gives people a lot to work with. Was there anything else that you wanted to make sure we covered?
It's such a broad topic that like we could almost go down, maybe have another episode where we go down every joint and some tips that I have for each joint and different types of injuries and even some more of these novel tips, because these are things that just basically they stimulate your thought process. Oh, I never thought about that. So there's other ways to skin a cat. And again, just to get back to the initial message, you have to find what works well, what resonates well for you. That PRP might be great for tendinitis. Static stretching and perhaps acupuncture for a stiff neck, a tight neck. If you have an ankle, if you roll your ankle, part of the premise of that article 2 years ago was the fact that I rolled my ankle in the backyard and was able to heal it within mere hours rather than taking days or weeks. And that's where the METH acronym came up. And it was basically by using movement, elevation, in particular traction, to open up the joint and allowing the nutrients in and allowing increased flexibility and allowing the lymphatic drainage and so forth. So that traction can be very important. So for ankle injuries, knee injuries, looking above and below the joint. A lot of people will focus solely on the knee, but really the hip is the hub of the lower body. So doing exercises that are going to promote some of the stabilizers, but not too much one way and not too much the other way. So, when you're using machines predominantly, you take the stabilizers out of the equation, while going too far the other way and doing circus acts on these Bosu balls and some of these other can decrease force production too much and actually predispose you to injury. I know one trainer who was he was out of commission for a few months. Why? Because he decided to do loaded squats on a Swiss ball, and he fell and he pretty much broke his hip. That's ridiculous. And so just silliness like that, right? Yeah. So you can go either way, right? So it just depends on the injury. Sometimes it's not even something physical that you need. For instance, low back pain. They say, what's the most common thing? The three most common things in life are death, taxes, and low back pain, right? Yeah, that's what they say, right? Well, do you know what the #1 predictor of low back pain is? Take a wild guess.
Constipation, digestive issues? I'm not sure.
Close, but it's actually depression.
Oh, okay.
Depression is the #1 predictor of low back pain. So a lot of times it's not physiotherapy that you need per se, but rather psychotherapy that might help. Do you know what I mean? So there are many ways to skin a cat. It's not like you can come with a one-size-fits-all approach. It just doesn't work that way. With backs, low backs in particular, if you have hypomobility, so if you don't have much mobility, well, maybe mobilization exercises are in order. And and vice versa. If you have hypermobility, this is where the stabilization exercises might be indicated, the side bridges, the planks, and so forth. So, but to prescribe that to everyone, maybe doing them a disservice. So you have to see what works well for that individual at that time, what resonates well for them. It's a very large topic, right?
Well, if people wanted to touch base with you personally to find out a little bit more about this and find out maybe some of the resources you have, or touch base with you in person, what's the best way to get a hold of you, and what would be sort of a hub where they could find out a little bit more about what you have, what resources you have available?
Yeah, we have a number of websites out there, but our main hub is catanzarogroup.com, which is basically my last name, group.com. Yeah. But what I believe would interest a lot of your viewers would be the Elite Trainer book, where we go through some of these progressions and some of these training programs. We didn't get too much into the training aspect, but I looked at that book.
I was actually going to suggest that because it seems like there's a lot we could talk about. If you're open to it, set up another chat in a couple of months, specifically getting into the training aspect of it. Like we can even focus on specific injuries, talk a little bit more about muscular imbalances, and what you were talking about, looking above and below the joint where the injuries is, exercises, that sort of thing. If you're up for that, that'd be great.
Yeah, absolutely, Josh. Not a problem.
That'd be awesome. So what was the name of the resource, the book?
The book is called The Elite Trainer, and they go to theelitetrainer.com for all the information on it. And that book was published in 2011, and it basically took me almost 10 years to complete that project. So it took a long time. But it's been very well received, and you'll see the number of accolades we had there. And I think a lot of people can get some real interesting tips from that book. One thing that we discussed earlier was about the progressions and how to taper and how to peak and so forth. And the book goes through, there's a section on that will go through that, so it'll help to clear that, that concept.
Excellent. Okay, that's great. So CatanzaroGroup.com and the EliteTrainer.com. I'll put those links down below, as well as some of the other references that we talked about. And stay on for a second after we log off here. John Paul, I'd like to talk to you a little bit as well.
Sure.
And thanks again for joining us for the chat. It was a great discusussion.
No problem. I enjoyed it. Thanks, Josh.
Lots of awesome information. So definitely do check out below and get in touch with John Paul. And his website will be a wealth of information as well there. Just take a look through it. And we will be back next week with another chat, so make sure you tune in then. And until then, stay strong.